can find that. Okay, so my name is Lisa Kelly. I'm the board president of Mental Health Awareness of Michiana, and I'm a mental health provider in our community. Mental Health Awareness of Michiana is a relatively new organization. Our mission is to promote mental health education, collaboration between providers, and to reduce barriers to care. So today we are talking about a really important topic, which is understanding grief and loss in a time of COVID. There are so many people who've lost family members, friends, to COVID-19, and we really felt it was important to have a presentation by somebody who understood grief and could kind of walk us through what we're seeing, and also give us a little bit of advice over how do we support people who are struggling with grief and loss. So I'm going to introduce Holly. Holly has her master's in counseling, Holly Farmer, her master's in counseling psychology from Notre Dame, and her bachelor's in psychology from Ohio State University. Holly is licensed as an LMHC in Indiana. She worked as a clinical counselor for a community outpatient counseling agency before joining the Center for Hospice Care in 2001. Holly has facilitated grief support groups for children, teens, and adults, as well as provided individual and family counseling. She's directed their annual grief camp for youth. Holly has presented both nationally and internationally at grief and palliative care conferences. And Holly has been in her current role as Director of Bereavement Services at the Center for Hospice Care since 2013. The bereavement department has provided bereavement support to an average of over 3,000 bereaved individuals a year for the past 6 years. So we know that you are busy, and we really appreciate your being here today and joining us for this presentation. Let me just do one logistical thing. I will keep an eye on the chat box. So as Holly is presenting, if people have questions, Holly may pause for questions, or she may wait till the end for questions. So I will try and keep track of questions that people ask. But rather than, you have the capacity to turn off or turn on your audio, but we're going to ask that you keep it off during Holly's presentation, and we'll ask you to turn it back on if at the end we have time for that. So there will be an evaluation that I send you a link to at the very end. Please fill out the evaluation. We value your feedback. We also provide an incentive. So there's a $25 gift card that we will send to, we'll pull randomly an evaluation that's completed by 5 o'clock today for somebody to receive that $25 gift card. So we for sure want to get your feedback. Okay, Holly, I'm going to stop talking and turn it over to you.
All right, well, thank you so much. I'm going to share my screen. All right. I did want to let you know that you will all get a copy of the PowerPoint. So know that that will come after the webinar is over. And my email is there. So if for some reason we don't get to your question today, or you're not comfortable asking it during the webinar, please feel free to reach out by email, and I will get back with you as soon as I can. I'm very honored to be here to talk about this really important topic. And I think to me, it's been an important topic for a long time, but so much more pertinent now with all the loss that everyone is experiencing. I know that this topic can bring up feelings and thoughts, grief reactions. And so, of course, if you have that experience, know that it's okay to step away, to mute me, or whatever you need to do to take care of yourself, and know that it would be okay to reach out to me at another time to get information that you missed. The Center for Hospice Care, just a little bit about where I work. It is a hospice and palliative care agency, so we do provide services to people at end of life. And bereavement services are a part of that model of care. But we also have a community bereavement program. So anyone in our area that is grieving the death of someone can use our services, and we do not charge for our counseling. Our counselors are all master's level, licensed in Indiana, and we have offices in Mishawaka, Elkhart, Plymouth, and LaPorte. We do individual, family, and we run a lot of groups as well. I also, because we're talking about bereavement and grief after death, I want you to be aware of our Center for Education and Advanced Care Planning. So if you are someone who is interested in more information about kind of decision-making at end of life, this is a resource in our community. It's a part of our Hospice Foundation. I think COVID-19 has brought up this. It's been more important recently because COVID is something that has been impacting everyone regardless of age. So we have people who are young that are getting sick and dying, and it's unexpected. And sometimes when we don't, when we haven't talked about what we would like our end of life to look like with our family, it can just make that process more difficult. So if you are interested in more information, this is a resource. So I'm going to give you some basic information on grief and mourning, talk about youth and adults, talk about the mourning process, and give you a view of what are typical and natural grief reactions. And I'll also talk about the specific impact that we've been seeing from COVID-19 on this, and then look at some coping tools, self-care, and talk a little bit about self-compassion, in addition to some suggestions for how to support grieving people. And I tend to get on a roll and just keep going. So I did let Lisa know that it's okay to interrupt me. If she sees a question come through that would be important, or she feels important for me to answer at that time, she can interrupt me and I'll handle that question. But otherwise, we can address questions at the end. So when you think about grief and bereavement and mourning, I imagine certain words come to mind. And when you look at these pictures, you might have thoughts about emotional reactions, sadness, despair, pain. But we have pictures of people who are smiling, and the mourning process people can have joy and experience pleasure during that grief process too. Mourning can include ritual, can include memory making. And grief is something that happens, it's natural and expected after people experience death, but also after non-death losses, and we'll talk a little bit more about that. Those are all images from our Camp Evergreen, by the way, which is a youth camp that we do for grieving children and adult and teens. It'll be our 28th year of doing that this year. But I want to start with just a few definitions so that we all kind of are on the same page. Mourning is it's a process that happens internally as well as externally. So it is what's happening inside with our thoughts and our feelings, but it also involves what we're doing publicly, our rituals that we do, how we interact socially. Bereavement is the state of having suffered a loss. And when we look at grief, there are a couple things that I think are really important messages when we define grief. For one, it's something that impacts our whole being. And so it impacts us cognitively, behaviorally, it impacts our spiritual self, and we can have physical grief reactions as well. So through our feelings and thoughts and how our body feels, all of these are a natural part of grief. It's expected to grieve. Sometimes we put it off. Sometimes we kind of deny that it's happening, but it is natural and expected to grieve losses. But something that's really important to remember, it is based on our perception of our loss. I think this can play a role. We were talking before everyone got on about the death of a pet. And there are some people who might look at that and say, well, why would you grieve? Why would you cry over the death of a pet? It really is our perception. And there are a lot of factors that influence mourning. And one of those is our relationship. And for some people, they might be like, well, it was just a cat. And for the person who lost that cat, it's like their daughter that they've been caring for and love. And so to remember that grief is based on our perception of the loss, and that's important to remember. For children, it's really, I guess, one assumption is that they grieve. And even infants have a reaction to a separation. And so if a significant person in an infant's life dies, they can have reactions to that, not being connected or attached to that person anymore, even though they don't have a sense of a cognitive ability to understand that that person has died. But kids, toddlers, school age children do grieve the death of someone and non-death losses as well. And so they are also adapting and having grief reactions. And it's important to recognize and pay attention to them when they have experienced loss. And COVID-19 has just brought so many losses to adults, but also to children in their routines, in their structure, in their connection with their teachers and classmates and friends. They've had a lot of loss that they've been dealing with. A lot of people have heard about the 5 stages of grief. It's been in major media. It's been in movies like Deadpool and the animated movie Epic, and been on The Simpsons and in other places. And Elizabeth Kubler-Ross is someone who did a lot of work with death and dying and found these 5 areas were common among people who were dying. And then that was kind of taken those 5 things and put on people who are bereaved, who are grieving the death of someone. Not that I ever met her, but it's my understanding that that was not her intention, to have it look like a linear process, or that you have to kind of do the stages in an order. But we really have other ways of talking about mourning. And so I'm going to share a couple other theories with you. I think one of the things I know is that not everyone's brain is wired the same as my brain, which is good. And so it can be helpful to present different ways of looking at mourning to hopefully help people have something that fits for them. But William Worden is someone who talked about the mourning process as involving accepting the reality that that person has died, or that we've lost what we've lost, and not just the reality of it, but the impact on ourselves. To experience the pain of grief, that is a holistic view of pain. So not just emotional pain, but physical pain, the pain that comes from social challenges that happen or can happen after grief. It involves adjusting to the world without that person or without what was lost. So that could be as maybe easily remedied as I've never pumped gas before, and how do you use these? What do you mean there's no full service anymore? To someone who lost their cheerleader, the person who supported them, encouraged them, helped them get through the day. And adjusting to those role changes and the loss of those people, that's a part of the mourning too. And then that last one really has to do with acknowledging that when someone dies, our relationship with them, our love, our conflict, our ambivalence, or the love of our life, that doesn't end when they die. We still have those thoughts and feelings and relationship with them, and it has to then be so different. And so part of the process is kind of, what do I do with those thoughts and feelings and relationship now that they're not here anymore? And then be able to live well. There's so much pain in the beginning, and eventually people can adjust and live easier. And so that's a part of that process as well. And there are a lot of factors that influence the mourning process. So like I mentioned with when a pet dies, what was that relationship with that pet? When someone dies, were they our caregiver? Were they a parent who kind of was helping us navigate the world and learn about the world? Did we feel like they had a full life? And what were those roles and functions? What was the relationship like that we had? Was it conflictual? Was there a lot of unfinished business that we had and that we're not able to then deal with now that they're gone? And of course, past losses and past death experiences can impact our mourning. So when we think about COVID-19, people have died before we were expecting them to. and feeling like they did not have the full life that they deserved or that we thought they would have. And there are communities who are experiencing multiple losses, families who are experiencing multiple losses. And of course, we know that communities of color are experiencing higher losses, more deaths than other communities. And so that is also something then that impacts mourning. When you have one death and another death, and I didn't have time to grieve the first one, and now there's another one. The circumstances of the illness and death, those are also factors that influence mourning. And with COVID-19, there is, for some people, a perception that the death was preventable, that maybe there could have been ways to keep that person from becoming ill with the virus. And then that can be lead to guilt in the survivors, especially if someone else had COVID and is concerned that they were the one that brought the infection to the other person who died. The perception of suddenness from the people we've been working with and from hearing about other people who do bereavement work is that many people are perceiving a death from COVID as sudden and unexpected. And so that adds to their mourning. The rituals, we've all heard probably about how people have not been able to do their end of life rituals that are so important to them. And then also not being able to do the rituals like usual after the death. So funerals being different, even if they're having funerals, not being able to hug or touch or even stand close to someone where they want to provide support or receive support from others. The caregiving roles prior to the death, so those end of life, like where we would want to be with our loved ones, being concerned that they died alone. Those are all factors then that add to what we're adjusting to, the pain that we're feeling, and what the person was told or not told about the illness and death. That can also impact mourning. And we see that a lot too with children, because sometimes adults don't bring kids into the conversation about what is happening, and kids will fill in the blanks themselves, and often they're filling it in with information that is not accurate, or they're taking blame for things that they don't deserve blame for. And so that's just, I guess, an encouragement to you all to make sure that the kids are being information shared appropriate to their development, but also providing opportunities for them to ask questions so can learn what's going on in their minds. Of course, our age, our understanding of death. So a 4-year-old is not going to understand that death is permanent, that it's universal. And so that impacts how they mourn. Our ability to cope with feelings and stress. How do we usually handle stress in our life? What is our health right now? And we know that there are health disparities in our communities. And so how healthy you are prior to a death can impact then your ability to mourn. We also know that caregivers can sometimes ignore their own stuff that's going on while they're caregiving for someone else. And we know that multiple people in a family can have COVID. And so all of those aspects can influence our mourning. The social factors as well, we talked already about rituals. For some communities, it's so important to do last rites or rituals regarding illness with people who are dying. And with COVID, those things have not always been able to happen. And so that adds again to the pain that people are feeling. Our support system also impacts our mourning. What's the quality of it? How many people do we have to offer us support? And of course, COVID is impacting that too. The need for physical distancing means that we are not getting together with our friends like we used to. Our kids aren't connecting with their friends like usual. And that physical distancing makes it so much harder to get the support that we need and to cope like we usually would prior to COVID. And then we also know that secondary losses, other stressors that are happening, are another factor that influence mourning. And COVID has brought so many of those job losses, eviction, food insecurity, all these things that add to the mourning that you're already experiencing after a death. And then with children, we know that how the remaining adults in their life, how they are doing, will impact how the children do with their mourning. So is there an adult in their life that will listen, that will ask to see if they have any questions, to encourage the children to talk about it? Because sometimes kids on their own will just be like, I don't want to bring it up because I know that I'm going to upset mom. I don't want to ask about dad. It's important for the adult to make sure they're asking the child about what they're thinking, how they're feeling, what questions they have. And of course, if the adults are grieving, are there adults that are kind of maybe further out in the circle, but still a trusted person to check in with the kids? And then again, communication styles. We've worked with bereaved where it was very clear that you just don't talk about it. You don't bring it up, you don't talk about it. And that can impact mourning if you're in a place where you don't feel like it's okay to bring up the person's name or talk about what happened. Something I think too that's really important to recognize is that there are different grieving styles. I think when we go back to those images on that the slide where I was asking what you think about when you hear the word grief and bereavement, an image of someone crying might come to mind. Someone who is openly expressing their emotions and very comfortable sharing about that, either verbally or about their, like, just crying in front of others. That we would call an intuitive griever. There are also instrumental grievers, and I think sometimes they are seen as not grieving because they're not emoting like we expect people to, and instrumental grievers tend to grieve more cognitively, so the thoughts they're having, and also behaviorally. So I remember working with a bereaved where the family really was concerned about this person and encouraged this person to come in for counseling, and he was willing, he came in. They thought he wasn't grieving because he wasn't crying over the death of this important person in his life. And what I realized was that he was an instrumental griever. He was grieving, it just didn't look like the rest of his family. He was in his garage creating a memorial that he was going to place where his loved one had died. That was the way he was grieving. We have blended grievers, so you're not, for a lot of people, you're not one or the other, you're this mix. But one of the challenges is when you are usually an intuitive griever and you expect to cry and emote and you're not able to. Or if you're someone who is an instrumental griever and you find yourself crying, that can just be really uncomfortable for those people when that's happening, and kind of add to that challenge of mourning. Just another theory that is one that there was research done in looking at this. They call it the dual process model. So it talks about people oscillating between a loss orientation and a restoration orientation. And that we talk about grief being unique, like there's as many people who are grieving, that's how many ways to grieve. I think the oscillation between these two is one of the ways that grief is unique, in addition to all those factors that influence it. You are the only one who had your relationship with that person who died. So we go back and forth between being focused on the grief and having those reactions and dealing with the kind of the acute experiences, adjusting to that person, kind of the loss of what they, the roles they had in our life, and going back and forth to restoration, where it's that time where you have to learn how to pump gas. And you might seek out someone else who's that cheerleader in your life, since that's what the role the person played. And then we just go back and forth between being in this grief and then being in this focus on adjustment and taking care of things. And as time goes on, the oscillation tends to slow down. And maybe we spend more time in that restoration and kind of living and adjusting and taking care of things. But we can go back to that loss-oriented place during times of important milestones that are happening or important days that come up, like an anniversary or a birthday. There is someone who did some research, and I have the reference in the on one of the reference slides, that for those of us who are professional caregivers in a role of mental health or physical health, or in some way we're caring for others professionally, there is someone who did look at this with respect to caregivers, and that we can go back and forth between experiencing the grief from the losses we experience in our work and detaching from it and kind of having a break from it. And that if we spend all the time in feeling that loss, we can burn out. And if we spend all this time in kind of that detachment, then maybe we're not doing such a great job connecting or being compassionate. And that, again, that oscillation is what is important, finding space to feel the grief for the people that we work with that we've lost. And then also needing that professional distance to be able to do the work that we do. Meaning making is another theory that is out there, where we talk with bereaved and they're trying to make sense of what happened or figure out who they are now after that person has died. And for children, there is a multidimensional grief theory that you can look that up if you're interested, where they talk about these 3 areas of distress, and their kids then are either kind of having adaptive and normative reactions or maladaptive ones. And I realized that these topics, some of them we could spend a whole day or even longer on each topic themselves. So I know this is brief and just an overview. So again, if you want more information, the references will be in the slides, or you can reach out to me if you want to talk more. But I did want to just give you a view of what are natural and expected grief reactions. So I mentioned that there are physical ones. We can have chest pain. Of course, it's not my place as a mental health counselor to tell you that your chest pain is grief. You need to go to the doctor. And so we are encouraging our bereaved to get into the doctor when they're able, to make sure that they're doing okay. Again, especially if they were caregivers, because caregivers tend to ignore their own stuff when they're caregiving for others. Cognitive grief reactions, we can have difficulty concentrating, have confusion, be absent-minded, forgetful, and for some ruminating on thoughts that are challenging, that make it hard to function or focus at work or at school. We can have a wish to join the deceased, and that's of course something that we need to assess for suicidal risk. But it can be a natural grief reaction to miss someone so much you want to be with them, but not be actively considering hurting yourself to join them. But it's important to assess for that. Emotional grief reactions, these are the things we kind of expect. The guilt is something that they're finding with COVID-19 that has been really challenging. Like I mentioned, people who might be feeling guilty, like worried that they were the ones that brought the illness to the person who died. And again, we want to make sure that kids are not taking that on. It's important to ask them and talk to them about that. Survivor guilt, if more than one person in the family had COVID and one person died, those that remain can have survivor's guilt. So it'll be a very important thing to assess for and talk about and help people cope with. The behavioral grief reactions, sleep disturbance, all these things are natural and expected when you have experienced a death. And then spiritual grief reactions. We have a very strong faith and belief system in life, the meaning of life, what happens after death. And then a death can sometimes lead to us questioning those beliefs and what we've believed for years. For other people, their faith and their belief system strengthens after a death, but our spiritual beliefs can be impacted after someone dies. And again, important to talk about this and check into this with people who are grieving. There has been talk too about COVID-19 impacting spirituality and wondering. So if you're in a belief system that believes in God, is this virus some kind of punishment? And that is a theme that is coming up for some bereaved. And then complicated and traumatic bereavement. So just on February 3rd, I attend webinars with the Hospice Foundation of America, and the Hospice Foundation of America sent an email out about a letter that a group of people in the field have sent to President Biden about the risk of complicated grief, kind of another pandemic that they're concerned about, and it being complicated grief. And so I wanted you to be aware of that. People like the Funeral Service Foundation, Tragedy Assistance Program for Survivors, Hospice Foundation of America, the Association for Death Education and Counseling, the Center for Complicated Grief. Those are just some of the representatives from those organizations that signed this letter to President Biden. If anybody's interested, maybe when we send out the slides, I could also forward that email from the Hospice Foundation of America. There is an opportunity then to sign on and say that you support the call for money and programming and support, so that we have a kind of a coordinated effort to address complicated grief. And the Center for Complicated Grief has put out that it's about 10 to 15% of bereaved who experience complicated grief. And those were numbers prior to COVID. There is concern that there will be a lot more with COVID-19, and we'll look at why they think that that's happening. Complicated grief can lead to physical health problems and challenges with functioning and lost productivity for companies, that it is a persistent form of intense grief. And there is this, well, what's the right time frame? And when we look at, so this is from the complicated grief, this slide. When we look at the ICD11 and the DSM-5, ICD11 has prolonged grief disorder as a diagnosis. And the DSM-5 does have persistent complex bereavement disorder as a condition for further study. And there's an assumption that it will be in a revised version of the DSM in the future. There is debate in the field about whether grief, it makes sense to pathologize grief. And so there are some people who are really against having diagnoses related to grief. But there are people who recognize that people struggle with it. There are times when people do not function well after they experience a death for a significant period of time. And so what do you do with that? And in our system, having a diagnosis is a helpful way for people to get support. Of course, at the Center for Hospice Care, we are not alone in that there are other places across the country that offer community bereavement at no cost, but it's not a common experience to find that in every community. And so for some, there's not an option to go somewhere where you can get quality counseling at no charge. And so having a diagnosis is one way to do that. I'm just letting you know that that debate goes on and that these diagnoses are something that is in the ICD11 and is looking at being added to the DSM. It really is for people who have this persistent yearning, longing, this preoccupation, intense sorrow, and all of this that really impacts their ability to go to work, to take care of themselves, their family, and that it's out of the kind of what the norm would be for their culture or their belief system. And that's some risk factors for complicated grief. And as we're looking at these, when we think about COVID, for some, the death of a child is considered a risk factor for complicated grief just in itself, but unexpected, seen as preventable, being isolated from your support system, having other major life stressors, experiencing multiple losses, all of those things are a part of what COVID-19 is presenting. That for a lot of people who experience a COVID-19 death, it's seen as preventable. It's seen as unexpected. For some, it's even seen as violent because of maybe the person was intubated. And so these are then risk factors for complicated grief, and the fact that COVID-19 has impacted our ability to be socially close with people, that is another risk factor. When we think about trauma, it is a threat where we are concerned about serious injury or death to ourselves or to somebody else. And of course, COVID-19 creates that opportunity for people to experience a death as traumatic. Our brain goes into that fight, flight, or freeze. We're on that hyper alert, the hypervigilance. It can overwhelm our usual coping. And then we can have a hard time functioning. And trauma also impacts the assumptions we have about the world. So we exist in the world and maybe believe that it's the world is a good place, that it's a safe place, that it's fair. Whatever those assumptions are, a trauma will impact those assumptions. And COVID-19, we're seeing that people's assumptive worlds are shattered. And so for some, a death from COVID is seen as traumatic. And then we can have distress because of it, and we might turn to coping tools that are ineffective or that have negative consequences. And bereavement being traumatic, I'm just going to read this. I actually attended a Hospice Foundation of America webinar with Therese Rando earlier this week, and she said she had updated her definition of traumatic bereavement. So this is the updated version, that it's a state of having suffered a loss when grief and mourning over it is complicated, or it's overpowered by the traumatic stress brought about by or associated with the circumstances. And again, this really fits for a lot of people who have experienced a death from COVID. So I guess the message here is COVID-19 has created a world or an experience where people are more likely to experience complicated grief, more likely to see a death as traumatic. And what that means is then they're not only having this natural and expected grief reaction because this person died, but they're dealing with trauma and a lot of challenges with functioning in their day-to-day life. And again, when we look at risk factors for traumatic bereavement, a lot of these fit for COVID-19 deaths, it being sudden, that they're suffering, that it was preventable, multiple losses. Maybe it's your child that's died from COVID, someone dying before their time. Those kinds of factors increase the risk of it being traumatic. I wonder, I know we have about 20 minutes left. I think if it's okay, I'm just going to keep going, and we'll, again, if you have questions and we don't have time to get to them, please reach out by email and I will respond. When we think about natural grief and even grief that is complicated, how we cope is so important. And also as professional caregivers, for those of you who are on that are professional caregivers, our coping is so important too. But the coping really needs to address the holistic view of us being impacted. So physically, are there things that we can do to help our physical health, like walk or yoga, to calm our mind with deep breathing and relaxation, to have a way to express our emotions in a safe way, in a healthy way, like creative expression, listening to music, having opportunities to laugh. I think when we talk about the dual process model and going back and forth between a loss orientation and the restoration orientation, one of the messages is it is okay to take a break from our grief, and to put it away and do what we need to do, as long as we're coming back and having time with it so that it cannot build up inside and overflow. When we have complicated grief, the ability to move away from that focus on the loss is really, really hard, and it can be helpful to have help for that. Mindfulness can be a really helpful tool, especially for people who are struggling with intrusive images and that hypervigilance, the anxiety. Mindfulness can be a practice that can help with that. Finding other ways to have ritual, because ritual can be a really good coping tool, but because our rituals have had to be different, coming up with creative ways to do that personally or within our bubble, the people that we are spending time with, that can be really helpful and important as a way to cope. The Tiny Survival Guide, I don't know if any of you who are local attended the conference Oaklawn had put on with the Trauma Stewardship Institute, but the Tiny Survival Guide is something that a lot of these things that have been on these last two slides are a part of the Tiny Survival Guide, a really helpful tool that kind of gives you the message that these things can be done and not take a lot of time. It might be that you take 5 minutes to walk either inside the building when it's not 12 degrees or outside the building when it's a little warmer, to just even for a minute walk outside in between sessions or meetings so that you can have a break and be mindful, be reminded of nature. Or sleep is important, but sleep is something that's impacted by our grief. And just, a lot of you have probably heard about mindfulness. It is something where we are present of the moment now without judgment. So you might in this moment notice how you're sitting in your chair, or notice that you're hungry because it's time for lunch, or that, oh gosh, I need to pick up milk on the way home. But those thoughts kind of come and go, but the mindfulness is to pay attention to all the senses in this moment. What do you smell? What do you feel? What are you hearing? And without judgment. And Mindfulness and Grief is a great website. Heather Stang also has meditations that she offers to people, and there's a book that she's written that's really good. Self-care. So sometimes self-care, I've been in the field a long time. My brain kind of turns off because I've heard it so much. It's so important, and I know it's important, and I'm a work in progress. Some days I do it well and other days I don't. But as we are caring for others, it's so important to care for ourselves. And it's not just what we're doing, but what we choose not to do. So like those cookies on there, I encourage you all to pay attention and figure out what your signals are that you need to pay attention to yourself and do some self-care. So for me, if it's 10 o'clock at night and I am wanting to make homemade chocolate chip cookies, and that is a sign to me that I need to do some self-care. And I admit that there are nights where I make the cookies and I eat way too many of them before I go to bed. And there are other days where I say, Holly, just go to sleep. And I'm able to just go to sleep. But overall, it's an indication to me that I need to nurture myself and do some things to take care of me. So I encourage you to find your own signs in your life. And I don't know, a few years ago, I had gone to a conference and they talked about self-compassion. And again, my brain kind of turns off when I hear self-care, but self-compassion was a new way of looking at it, and it spoke to me. So I wanted to share it with you. We deserve the same compassion that we provide to others, that we would give to our closest friend. We deserve that too. And so if there are ways that you can give yourself compassion, be kind to yourself, that will be helpful in your ability to care for others. And Dr. Kristen Neff has this website, selfcompassion.org, that I encourage you to go to if you want more information. So supporting grieving individuals, and I know we're getting close to the end. Some of this just seems simple, like be there and listen. That can be hard though, especially with our physical distancing. So we have to get creative about how we can do that. We can't always sit with people in the same room or on the same couch. But for those people who are grieving, reaching out to them and giving them opportunities to talk as they need to talk and to cry as they need to cry, or help them build that memorial if they want help. It's okay to say that you don't know what to say. And I think a lot of times we hear from bereaved, people won't say their name anymore. Like they don't want to say their name. It can be helpful to ask someone, would you like to talk about the person who died, and then provide that opportunity for them. Encourage use of rituals and those coping tools. Words that may hurt, you may look at this list and be like, oh no, I've said these things. I guess the message here is to use language that the bereaved person uses. So if they are saying, I know my loved one's in a better place, then it's okay to use that language. I encourage you not to use this language though, if they haven't used it. One of my best friends from high school, Donna, she experienced the death of her 2-year-old daughter, Andrea, suddenly and unexpectedly. And she is someone who is very religious, has a very strong faith. And in her community, they were saying, well, Andrea's with God, she's in a better place. And in the beginning, the only thing Donna thought about that was, no, she belongs with me, like I'm her mother. Now, eventually, Donna was at a place where she could use that language and it was comforting to her. But in the beginning, it wasn't. So I think there's potential that these statements might lead to pain in the person who's grieving. And so again, to only use language that they're using, that can be a safe way then to provide support. And things that can be helpful. I have worked with bereaved who are like, I'm sick of people saying they're sorry, like they didn't do it, you know, why are they saying sorry? So there are people who aren't comforted by that either, but in our world, this is a common accepted statement that we're sorry that they're experiencing what they're experiencing. But it is also okay to say, I don't know what to say. This is just, wow, I don't know what to say, but I'm here for you. I'm going to keep you in my thoughts and prayers. And then offer, you know, what would you, sometimes bereaved people don't know what they want. So would you like to go for a walk? Would you like to, you know, watch a movie on Netflix where you're at your house and I'm at my house and we can watch it together. Just offer distraction or time to focus on it and be there for what they need. And while you're being there for them, important to take care of you as well. And some of those signs that people might benefit from some professional support or additional support is if they really are having a hard time functioning in their daily life, that if you're recognizing that they're using substances as a way to cope and that's, you know, impacting them. If people are completely withdrawing from their social network, of course, if they're talking about suicide, knowing that wishing to be with the person can be a natural grief reaction, but if they're talking about it, it's it needs to be assessed to make sure that they're not suicidal. And in our community, of course, I've mentioned the Center for Hospice Care is an option for support. Faith communities, for some people, having a trusted faith leader can be a wonderful place to go for support. For some people, they have employee assistance programs at their organization. General mental health counseling, I'm aware that in our community, there can be a pretty long wait list for people, which is really hard. There's also online support. I know there's COVID-19 has also brought about more telehealth options and places that are providing mental health counseling over online. Did also want to let you know, I didn't mention before, we have an art counseling program. Our art counselor, Dave Labrum, works out of our Mishawaka office, and he tends to work with individuals who've experienced the death of a child, often from sudden and unexpected ways. Lots of resources. Then anything that I've mentioned today, there are like the trauma stewardship, complicated grief from Columbia, the College School of Social Work, the Mindfulness and Grief. Those resources are here. There are some other ones specific to children who are grieving that might be helpful. And then I did want to let you know too that in the webinar I attended with Hospice Foundation of America, they've talked about a couple of scales that have been created that are available online for free for public use. One is the coronavirus anxiety scale, and one is the pandemic grief scale. And so I just wanted you to know that those are available. So if you are a provider and think that that might be helpful to be assessing for that, these are options. The Center for Complicated Grief at Columbia also has some tools. There's a cost to those. And then there is also one for prolonged grief disorder that's available online as well. And then I just have references that if you want more information about the topics. And again, I know we're going to have some time for questions if anyone has them, but please know that it's okay to reach out by calling or emailing. And I guess I will stop share and see if there are any questions.
Holly, I'll ask the first question. I was really struck, when you were talking about complicated grief, about the early part of the pandemic, when we were hearing about families, kind of unknowingly gathering, and there being 5, 6 family members who died, which has continued, I know in other families. But are those families more likely to have complicated grief when they've lost a fairly large number of people?
Yeah, so I think when we look at those risk factors, I would say, yes, they're at higher risk of complicated grief, multiple losses, the deaths being sudden and unexpected, all those, probably other non-death losses that have happened as well, that yes, they would be at higher risk. Of course, not everyone will have complicated grief from a death that's traumatic, but there's more risk. And so knowing that some of those symptoms of, dysfunction in their daily living and that intense yearning and longing that lasts and they get no break from it, that those can be signs to encourage them to get support and to, whether it's through counseling or from their faith community or something.
So we have about 5 minutes left, and everybody has the ability to unmute themselves and turn their video on. So if people want to type in the chat box, that's fine. But is it okay? Are you okay with that, Holly, if we just let people go ahead and ask questions?
Hey, everybody. Not so much question, just a unbelievable timely thing. I was delayed this morning because of the weather, whatever, and I had a busting headache. So I stopped at the store on the way in by listening and participating with my phone. While I was in line, a gentleman walked in, somebody, he lost his wife earlier this week, and we're going to the viewing this evening after work, and having a webinar in my ear about loss and everything. So I missed part of it. So thank you so much for recording this so I can check in later and hear the rest. But he outside the store, he was able to tell me his story that she wasn't feeling well, checked in at work, they met at home for lunch. She looked worse. She's 46 years old. She lost consciousness. He's CPR, calling the ambulance, and anyways, so I was able to just I know this is not a comfort to you now, but hopefully in the future you'll be able to realize that you were with her and she wasn't alone. And then he said, but did I do CPR right? Did I call the ambulance soon? All of that. And he said, I know people have said not to do that to myself. And I said, I underline that as well. But, so anyways, just again, the timeliness, and thank you so much for bringing this information and making it available to us. Just me directly right here, right now. Thank you so much.
Welcome. And we do have a young widow and widowers group. Not that you're going to see him again, but that is one of the groups that we run.
Okay.
Yeah.
I'll look into that and share it with them. Thank you so much.
Mm-hmm.
Holly, this is Jenny Hunsberger.
Hi.
Hi. I have a question about particularly residents in maybe nursing homes or our elderly kind of in congregate living, assisted living, and who have gone through this period where they've been very, very isolated, haven't had visits from family, and have had the people that they're living with die at really tremendous rates, close friends, and they haven't been able to go through the rituals of attending the funeral or any of those things. So they're both have been now a year of isolation, have lost a lot of people, haven't gone through that, are facing their own fears, the end of life. And now we're moving into a stage maybe where people are vaccinated and maybe they're, people are feeling like, well, I'm going to live through this. I didn't know if I would, but I'm wondering about resources, or how do we think about supporting that group of people moving forward as you try to take the next steps? It's kind of a big question.
Right. My thoughts include, as facilities are able to allow their residents to gather, to have rituals of remembrance, to have opportunities for them to mourn together the residents that have died. That probably would be helpful for staff too, who have also then lived through those losses. We've also seen people having some intense cognitive grief reactions. When we're not able to do those rituals, it can be harder to accept the reality that those people have died. So I think doing those rituals, reading the names of the people who have died might be helpful for those residents to grieve and maybe start their mourning that they've had to put on hold because they haven't been able to be together with others to mourn. So those are some thoughts, is creating rituals so that the grief can be acknowledged and they can have a way to mourn together. There are also some other tools, other kind of memory making things, like having a wreath that hangs with ribbon, and residents could write messages about the person who died, or memories or intention or wishes, and then tie it to the wreath. So it could be different colors of ribbon. We've done that when we've had employees that have died. And then it's something that can be a personal a ritual of remembrance for the person who died, but then also a community acknowledgement, because the wreath would be visible and could be added to over time. That's just one example of that might be helpful too. And then I think just once the visiting can happen with these residents and their loved ones, that will be a huge benefit to those residents to be able to have connection again and physical reassurance and how helpful that is, and how hard it's been since it's been missing. But just encouraging that, I think, would be good.
Holly, it's 1 o'clock, or just after 1. So I want to respect everyone's time, including yours. Thank you so much for your presentation today. Really, perfect for the time that we're in right now. So thank you so much. And for the resources, I will send out that PowerPoint with all of those resources that you've listed that everyone will get this afternoon. So thank you so much for your time.
Well, thank you for having me. I appreciate being able to talk about something I'm passionate about. So thank you. And if anybody has questions, please reach out.
Great. And I'm going to send out the evaluation link shortly. So please do that. And if you do it by 5 o'clock, don't forget that you get a chance at winning a $25 gift card. So please do that. And I will be sending some information about our next webinar that we'll be doing in 2 weeks. So thank you for coming today, and I hope everybody stays warm and safe for the rest of, rest of the day, the rest of the weekend. Thank you so much.
Well, and thank you for doing what you're doing, the webinars and providing information. It's a gift to the community. So thank you very much.
Thank you.
Thank you.
To be able to.
Thank you to both. Thank you.
Bye.
Bye.
Okay. Good job, Holly.
Oh, thank you. It feels like there's such big topics and hard to do in a short period of time, but at least hopefully it validates what people are seeing and experiencing. And
yeah, you did a really good job of moving through a lot of information. So thank you for doing that.
You're welcome. Oh, do you want me to, I can forward the Hospice Foundation of America email?
That'd be great.
I was just really, that was timely, and thought it might be helpful to share.
Mm-hmm.